Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez, your host for another important health topic. Obviously, through the years, we've talked about a lot of important health topics. We've talked about all types of cancer. We've talked about heart disease, women's conditions, men's conditions, children's diseases. But behind the scenes, there's a healthcare provider that helps all of these conditions, and that is a nurse. Nurses are instrumental to the healthcare of our country and to the healthcare of Americans. There are millions of nurses in our country, and nurses outnumber doctors 3-to-1. So why have I not had nurses on our show to talk about nursing and what nurses do in healthcare and in wellness? So obviously we just celebrated May. Early in May of this month, we celebrated Nurses Week. And obviously in celebrating Nurses Week, I thought we would bring a very special nurse to be with us today. So I brought Vanessa Gonzalez, newborn neonatal ICU nurse at South Miami Hospital. So what makes Vanessa very special? Well, Vanessa is my little sister. So not only is she a special nurse and she takes care of the smallest of patients, but she's my sister. Welcome, Vanessa.
Thank you, Tony. I'm very happy to be here.
All righty. So Vanessa, tell us a little bit about yourself and who you are and how'd you get into nursing?
So I always had a fascination with healthcare and helping others. I knew I wanted to do something to make a difference. So I did go to nursing school here in South Florida, and throughout my nursing school career, I fell in love with the neonatal population. So I decided to go into the NICU, which I've been working for the last 15 years. I absolutely love what I do. I've worked in 2 different hospitals, and I feel like that's the population that I really love.
And so the neonatal, and there's an interesting story. You always talk about how at the beginning of your nursing career or your nursing education, you were concerned that you were like, maybe nursing's not for you. Because there's a lot of areas in nursing and, taking care of adults and maybe in medical and surgical areas you didn't like. Talk to us about that.
Correct. So during my nursing school career path, I enjoyed it in theory and in my classes, but when I went out to the clinical setting, I just didn't enjoy it. And I had one nursing professor tell me, just wait until you get to obstetrics and pediatrics and you may find your niche there. And I'm very glad that I listened because I did. I fell in love with pediatrics, but I fell more in love with the neonatal population. Once I went into obstetrics, I was able to see that side and these vulnerable patients and how I could really make a difference with them and their families. So I'm grateful to her because I stuck with it and here I am.
There you are.
Yeah.
All right. So tell our audience and explain what happens in the newborn ICU. These are little babies. They could be 1 pound, 2 pounds. What is it to be a nurse in that neonatal ICU? How is that?
So no 2 days are ever the same. We have babies from 22 weeks, less than a pound, to full term, which are sometimes up to 13 pounds we've had, all very different needs. So our role is to help them get along and go through their stay with us is just to basically mimic mom's womb as best as we can throughout their stay so that we can help their health and get them to a point where they're able to go home, to a healthy point where they're able to go home.
And some of the common conditions that these babies are suffering from when they're in the NICU, what type of problems do these babies have?
So in utero, when mom's pregnant, the last organ to really fully develop are the lungs. And so most of our babies have respiratory distress, whether they're full term and they just need a little bit of help, a little bit of oxygen to get them through, or their lungs are too premature, so we have them on a ventilator supporting their respirations and some other medications that help them with that until they're able to wean off of all of it to be able to breathe on their own and go home.
So taking care of a patient in an adult world, you deal with the patient. Sometimes you deal with the family. But here, you have to deal with the family, right? Because you're talking about a newborn baby. Baby can't communicate. The family is very anxious. How is that, talking to the family? How is it dealing with those family members?
So the most important thing with these families is empowering them, right? Because they are so helpless. This is not an anticipated situation for anyone to have, whether it's a preemie come to us, nobody's really anticipating preterm labor and having a premature baby. And then also, if you're full term, you're not anticipating a NICU stay either, because you think you've made it to term and now you're going to have a healthy newborn. So it's very challenging. We try to empower them and incorporate them in the care of their baby as much as we can. As little as even taking a temperature on a 1-pound baby for them can mean the world. So we try as hard as we can to keep them involved in the care, in the information that's happening with their baby, updates on their status, what's the plan of care, what's next, what's to come. We try to keep them as much involved with their baby's care as possible.
You know, I remember you telling me that you told me stories of how they hold their babies even when the babies are intubated.
Absolutely.
On a ventilator, and they can hold their baby, and that's safe.
Absolutely. So it's called kangaroo care. It's something that's very important to both baby and mom and dad. We do it with the dad as well. And together with our team, our respiratory therapists and our nurses, we're able to put these babies skin to skin on mom or dad's chest. And it does wonders for them, even intubated. We're able to move our ventilators over and they're able to hold their baby.
Wow, that's incredible.
It
That's
is.
incredible. All right, so your role as a nurse in the newborn ICU. Talk about some of the things that you can do as a nurse. What are some of the roles that you do as a nurse? And what are some of the things that nurses are not doing or shouldn't be doing?
Okay, so things that we can't do are diagnose, right? So as you know, as a physician, so the doctors give all the diagnosis. If the patient needs to be intubated and have a breathing tube and airway, the doctors do that. And they recommend the care and, kind of plan the care for these patients. As nurses, our main thing is assessing and relaying information, any changes to their status, any changes to how they appear. We let our physicians know, and together with our team, we make a plan and change. We can insert IVs to give IV nutrition, hydration, IV medications. If you're certified in PICC lines, which I'm a certified PICC nurse for neonatal patients, that's something that we use often. It's a peripherally inserted central catheter. We use them often to provide long-term nutrition because these babies aren't always eating. We can insert feeding tubes, whether they're oral or nasogastric, and they can eat their feeding through there if they can't take a bottle or feeding. And they can do that on adult floors as well, or pediatric floors. These are things that all nurses can do in their scope of practice, in their area of practice. And basically things like that, urinary catheters we can do as well, blood draws if they need, to have some labs drawn, things like that.
So the average baby stays how long in a newborn ICU?
The average baby, I would say, is about a week to 10 days.
Oh,
Sometimes we can have them up to a year. They're with us for several months. If they're very premature, then usually what I tell my parents, if they do have a premature baby, is kind of anticipate what your due date was. That's more or less when we're going to go home, give or take a few weeks.
Okay.
Right? So if you deliver a 23-weeker, whenever you're 40 weeks, whenever they tell you your due date was, that's when usually you go home. Now, along that road, it's a very long road for them. So sometimes there are complications and things that, require them to stay longer. And we try to support our families as best as we can and empower them, because at the end of the day, they have to take these babies home and they have to know how to care for them.
Yeah. So how do you prepare a family when they want to take a baby home, and sometimes they have to go home with feeds and other things? So how do you prepare that? And do they have transition to a nurse at home as well?
Sometimes we do. Sometimes our babies go home on monitors. So we have someone from a monitor company come and train these families. It's important that they know what to look for, what sounds, when to call for help. Sometimes our patients have to go home on oxygen, on a little nasal cannula, so they need to learn how to work that as well. And we just constantly show them signs of things that are wrong. So we try to have them stay with us overnight as long as they can, to practice and do the care on their babies, so that when they're home, it's not such a shock and they're comfortable in feeding and changing diapers and adjusting the oxygen if they have to, things like that. Sometimes they go home on medications. We have pharmacists that come and show the parents exactly how to administer the medications to their babies, the doses and things like that. And then they follow up with their pediatrician after.
Wow, that's incredible. A lot of work.
A lot of work.
A lot of work preparing them. Okay, so the babies go home, and then talk to us about the reunions that occur. What happens in these reunions later on? You know, babies get big, and they may become little toddlers, or they may become, you know, children or teenagers, and then they come back.
Yes.
So talk to us about these reunions.
So they're very special because we work hard with these patients. These families become families to us. We become families and their support person.
Especially if you spend a year with you.
Absolutely. Yeah, we definitely become their support system. So it's nice for them to come back and kind of show off their child and how well they're doing and how much they've accomplished. So it's definitely nice to see, and it's nice for the families, for each other, them to have a support system within each other of, you know, well, they can compare stories and, you know, their situations, and, you know, sometimes they have long-term struggles. So it's good to see someone else that has been in your shoes, that have, you know, gone through similar circumstances.
And you told me also that there's a support system along the way. You know, as a family, you have a child there, you don't see the light at the end of the tunnel, and you may want to connect with another family member that has had those challenges. Talk to us about that. There's a company that helps with that?
Absolutely. It's a nonprofit organization. It's called ICU Baby. They come to us and they come to several other hospitals, and they kind of provide support for the families. They provide a lot of resources for them to be able to get through these difficult situations. They arrange meals for them to communicate with each other within the hospital, families that are already there. And it's really nice for them to have someone else that's going through the same situation as them to compare, and just have, you know, someone to share these experiences with that's going through them themselves. What's
the best part of your day?
The best part of my day
besides when you see me or hear from me.
Well, that's hard to beat. The best part of my day is just that feeling of when the parents are grateful for your care, and they're grateful for the opportunity to spend time with their baby and feel empowered and being able to care for their baby. To unite that family, for me, is very special.
You know, you're right. For me, too. I just saw a patient after surgery in the office, and he's grateful for the care he received and thanked me. So it kind of is full circle. You're trying to help people, and people are grateful. That's what makes our world wonderful.
Absolutely.
When that happens, of course. Okay, so let's shift gears. We've learned about NICU. I know what you do in the NICU. I understand the complexity of these babies. Let's back up and talk about nursing. So talk to me about the nursing profession. You know, what is the nursing profession? Give us a little bit of history of it, because maybe people want to know about nursing. Maybe there's somebody considering a career in nursing.
So the nursing profession is really beautiful because it's so dynamic. You can do any area that kind of strikes your interest. So like I said, we talked earlier that, you know, first 3 semesters into nursing school, I'm like, I don't think I want to do this. But then I found my niche, and I'm very grateful that I did. So there's so many areas. There's pediatrics, where you work with children. There's surgical, where you work in the OR. You have pre-op, where you can prepare these patients for surgery, and then post-op, where you make sure they've recovered and are well enough to go home. There's home health. You can go and provide care, nursing care, to these patients at home when they're in like a rehabilitation situation, or providing medications to them at home. There's so many areas that you can really make a difference as a nurse, and you work with a team. You're not on your own. You have physicians and nurse practitioners to kind of guide you. You have respiratory therapists, occupational therapists. We all work as a team, and it's definitely a beautiful profession.
And the career. So you go to college. So what's the pathway to become a nurse?
So you go to college. There's I got my bachelor's in the science of nursing, and you can have an RN license. You have to get certified by the board through the state or multi-state, however you prefer to do it, and then you can become certified in your specialty if you desire to do so. But yes, ultimately you get a registered nurse license, and most hospitals now require a bachelor's in the science of nursing.
And I've seen also there's now what we call residencies, right, for nursing. Where is that because the education inside the nursing programs are not strong enough, or they have to do a residency?
Residency, I believe, help with placing nurses in an area that is going to they're going to enjoy and that they're going to work in, because sometimes it's hard to decide, where if you don't know already from when you finish school where exactly you want to work. So it's a nice, because they place you in areas where you may be a good fit, areas of nursing that need nurses. And then these nurses may have shown interest in those areas. So it's nice because then you get an extra orientation in that area. You get a little bit more time to learn that specialty. So,
and you're working and getting paid for it at the same time.
Correct.
Okay. All right. And then, some people get into leadership. I know you were in leadership in at one point. Talk to me more about the administrative role of nursing. How about those nurses? I mean, I have nurses associated with a couple of my programs, a surgical program and a bariatric program, that they are just behind the desk.
Absolutely.
They're reviewing data.
Yeah.
They're reviewing outcomes. They're looking at whether a patient's having a complication. They're helping us in quality initiatives. What about that aspect of nursing?
So absolutely. It's definitely, so at the bedside, nurses are providing patient care. And then we have what we call a patient care supervisor. So we have these positions where they ensure that the nurses are providing safe and quality patient care. And then we have those that are improving quality. So looking at trends, getting data, research in our units, and also to see, are other areas doing things in a different form that are providing better outcomes, just to improve ours and our patients' outcomes overall. So it's more like quality improvement and making sure that things are run smoothly, because the nurses are also very busy providing care to their patients. They're making sure that we're doing it in an efficient and the best way possible for the best care for our patients. And
so what's the pathway for that? Somebody who wants to get into that, is that first you have to be a bedside nurse and understand bedside care first, I would imagine,
Correct.
Right?
And then you would need, if you, depending on how high you go, you would obtain a master's degree, sometimes even a doctorate in either leadership or education.
Healthcare administration as well.
Healthcare administration is another one, yeah.
Wow. Okay. And in regard to the progress of nursing and in your career, have you noticed the work-life balance? It seems like nursing is a great career. It's why probably the majority of nurses are women. You have the balance of your home, you have the kids and everything else. Correct. Talk to us about that life-work balance, because you can work 3 shifts of 12, right? And then you have 4 days off, and sometimes you can even work at night, like you did for many years.
Yes, I did. Yes. So you can. And there's other areas where you work early mornings, 4 days a week. So it's definitely a profession where you can have work-life balance. And if you fall into a situation where you're getting fatigued, you can also, try to change your hours. We have part-time or per diem where you work, as needed. So there's definitely room for a balance, because you can change your shifts. You're not stuck with like a Monday through Friday, 9 to 5, unless you have that role, like in a pre-op or post-op situation, outpatient, which sometimes that works very well for.
Yeah, some people work
nurses.
Monday through Friday, 9 to 5, and then some people, have to work nights or weekends or whatever.
Weekends, exactly.
Right, so it's variable, which is good, because you can just tailor it to your life and your family.
Which is what I do, and it definitely works well for us.
Awesome. So what about, you talked a little bit about burnout and fatigue.
Correct.
We saw a lot of this on national news during COVID. Is this something that has happened in nursing even before COVID? Is it COVID that did it? Talk to us a little bit about that.
It's always been there.
I mean, you were protected literally from it because you didn't see it really in the NICU, right?
Very small. We definitely didn't experience it like ICU nurses or even med-surg nurses. We didn't in the NICU, fortunately for us. But I definitely know nurse fatigue has been around forever. They're long shifts. They're mentally, emotionally, and physically exhausting. So my best recommendation when I feel like that is, if you have a bad situation, or you've had a bad shift, or a code or a death or an altercation, debrief. Get your team and talk about it and how you can improve those areas, those situations. How can we do it better? How did we do it and it worked well and we can continue to do it this way? Speak to your leaders. How can I, lessen my load? Maybe you're involved in too many things and you need to scale back. Because there are so many opportunities for committees and improvement in your own workplace, but maybe you need to scale back. But if you don't speak up or communicate with your team, you shouldn't suffer alone. So definitely communicate with your leaders, debrief, go through all of those things to be able to prevent that fatigue from happening, is my opinion.
Good. What has to change in nursing? What has to get better, or what has to change? Is there anything that has to change? There's a lot of documentation.
There's a lot of documentation.
Okay. I mean, is it easier now documenting with the computer as opposed to the old days with paper and charts? You're young enough to
I prefer paper charting.
Really?
I started with paper charting.
Yeah, I know. You're young enough to be a paper chart, right?
Yeah. I mean, I started with paper charting. We definitely spend about, I would say, a third of our shift documenting. I would prefer to be more with my patients and spend more time doing patient care. But of course, we have to document what is occurring during the day so that we can improve our patient's care. And, that's kind of where we all communicate, is through that patient's chart. So it's important that we document, but it definitely does take up a huge chunk of my day.
Well, I'll let you know that there's some AI coming, which we were kind of partially involved with, where while you're caring for your patient, you wear some glasses, it'll document visually what's happening, and you can dictate what you're doing, and that'll be documented in the chart. So it theoretically supposed to decrease the amount of time that a nurse spends in documentation and more in patient care.
Well, that's incredible.
We'll have to see if that really works, and how it works and so forth. But yeah, that's something that they're trying to do.
Wow, that would be really helpful.
Yeah, for sure. So what advice would you give a young person out there who's thinking about maybe nursing, thinking about maybe medicine, maybe want to be a doctor, maybe want to be a nurse? I know somebody who maybe wanted to be a doctor before, right? What is your advice to that young person?
I would speak with as many doctors and nurses as you can and get your feel for their experience and their daily life and what schooling they had to do, and if that's a path that they would want to do. I think nursing is a beautiful profession. I think it comes in so many shapes and sizes. You can do so many different things. And if you get tired of one area, you can always go to a different area and experience something new. And at the end of the day, you're providing care and helping others feel better and making a difference in their overall life. So it's definitely a beautiful career. It's just, which area would you prefer to go into? But
yeah, we haven't even talked about nurse anesthetists,
Correct.
which are those that provide anesthesia and put patients to sleep. Nurse practitioners who are like physicians, who can work independently in the state of Florida, who work with physicians and help in practices. We have a lot of nurse practitioners within our surgical program and our bariatric program. The nurse anesthetists within Baptist Health, they're all over. So those are just further advancement in their career. They just have to do more education. Correct. All right. Well, on behalf of all the physicians and on behalf of our community, thank you. Thank you to you. Thank you to all our nurses. Thank you for coming today and spending a few minutes with me.
It's my pleasure.
All right. And thank you for what you do for all those babies.
Thanks.
All right. So once again, Dr. Anthony Gonzalez with Miami Community Health. Thank you to our nurses. Happy Nurses Week. Thank you for helping us in the healthcare that you provide to all our patients, whether it be in the office setting, in the outpatient setting, the clinic setting, or in the hospital setting. And once again, Dr. Anthony Gonzalez with Miami Community Health, reminding you to take care of yourself and your family. Be well.